friends, so welcome back. I just did something that I've been thinking about doing for a really long time. I had a treatment, PRF, which is platelet-rich fibrin. If you've been here a while, you know I don't do a lot of procedures. I'm very intentional about what I do and why. I don't have a lot of money to blow on procedures. So today I'm going to walk you through why I did this one, what the process was like, and what I expect to happen as a result of this procedure. So grab your coffee, let's get into it. So what is PRF? The next generation of PRP. They draw your blood, spin it in a centrifuge, and separate out the parts full of growth factors, platelets, and white blood cells. The key with PRF is that a natural fibrin matrix forms, and that matrix releases growth factors slowly over time. Slow release means longer stimulation, which means more collagen production. Here's what I did. The skin under my eyes has been getting noticeably thinner, like right along here. And you can't really see it with all the light. You can only see it in certain light. Like they're not always there. Like I can see it in my bathroom light, but then I put the mirror in and I look out the window and it's like, I can't see it because any kind of light on my face like completely vanishes it. But you can see it, which means the skin is thinning there. I have a little bit of bagging like right above my eye. It's kind of genetic, it's hereditary, and it makes that hollow look worse, right? Especially when I'm wearing makeup, which y'all know I love my makeup. Like I love makeup. I don't know why I love doing it. It's fun. It's like art. I'm an art. I do art too. So like maybe that's, I think it's fun. It's so much fun to do makeup. I get carried away sometimes. I'm like, I'm just gonna do a natural makeup. And then I'm like, I come out full glam and my husband's like, I thought you were gonna do a natural makeup. And I'm like, yeah, but I was having so much fun. So because of this, I was like, oh, no matter what concealer I wear, no matter what I do, I've tried all the tricks on TikTok, I can still see them because you can see the blood vessels underneath, and then that's where the dark eye line, where my natural line folds when I smile and laugh, and haha, it's like right there, haha, yeah, so that's it. So part of it is from years of expression, part is thinning that happens to your face just naturally over time as your mid-face starts to drop, and there's a little bit of thinning in that area. It's pretty common. I've been microneedling at home since 2019. I did go a small little stint where I wasn't doing as much microneedling. It was like right after my wedding, and I had a really crazy, like insane job at the time that was making me work about 70 hours a week or so, and it was just a lot of work. So I went through a stint where I wasn't needling, and I think that's what helped kind of make this area worse, because I wasn't doing the needling that I should have been doing at the time. And I've still been trying to needle it for the last 4 months, and I hadn't seen any real improvement. So I thought, you know what, I'm gonna try this new PRF. We'll see if it actually helps like give it a little bit of a boost so then I can just go in and needle underneath it. I'm also not ready for anything drastic like a surgery, because you know I could get a blepharoplasty and that would help like get rid of the bulge, which would help make it look better. PRF really checked all of my boxes. It uses my own blood. There's no risk of allergic reaction. It's not synthetic filler, so there's no risk of like it getting clogged. They didn't use PRF Easy Gel too, which has been known to clog. You've got to check that. If the PRF being used is Easy Gel and it's not a platelet-rich fibrin gel made from your blood cells directly, like mixed and made right there, then you do run the risk of getting it clogged in this area. Okay, it's called the Tyndall effect, but it can cause a lot of like unwanted side effects that you can permanently damage things in that area. So this actually works to make the body stimulate more and more collagen, kind of like microneedling, which is exactly what I wanted. So let me walk you through the process, because it was quite a process, right? The blood draw. First and foremost, they drew my blood and my vial spun while my face got prepped. They injected numbing agents into my cheeks so that would numb this whole area. And then they put on a topical numbing gel as well. And I sat there while my blood spun, and the nurse went back and made the gel that would go in as my under eye filler. And I say filler like this because it's not a filler that's gonna stay there. Like the effects are gone. After a week, that filler just settles in and that's it. It settles in and you're done. And then you have to wait for your body to start building more collagen. It actually takes quite a while for them to fill your entire eye area. They inject the needle in here and then they go in like that. Okay. And then she just slowly released the PRF gel into the whole of my trough area under my eye. So it's not a quick stick. Most of it was painless. There were a couple points I was like, and that's because there were some nerves over there that when you get near them, especially out here, and then I think it was like in here somewhere, there was another nerve that was particularly a little painful, but not too painful. I did feel a little something though. The laugh lines were the easiest to inject. I didn't really feel them at all except toward the top by the nose, which is a little more sensitive. Recovery was not bad. The first evening the swelling started. So as you can see, I had some swelling in the first 24 to 48 hours. Day 2 is probably the worst swelling. Okay, there's day 2. Day 3, it starts to go down, and this is all completely normal. Most people see swelling peak about 24 to 48 hours after the PRF, and then it resides over the next, or subsides over the next 3 to 5 days. So it's pretty, the swelling did go down pretty quickly though. I think 3 days, the 3rd day of swelling, that was it. And it was pretty much almost gone. And day 4, I had 0 swelling. One thing to know going in, the initial volume from the fibrin itself reabsorbs within about 2 weeks. So you might look at yourself in week 2 and think nothing happened. And that's normal, right? The real results from come from your body's collagen building, and that shows up about weeks 3 to 4, and it gets better at weeks 6 to 8, and the full effect is around the 3 to 4 month mark. So that is the whole shebang. So right now my under eyes are doing their thing, right? And I'm trying to feed it lots of collagen, right? Making sure to take my collagen. Guys, take your collagen. If you're needling and you're doing all these, take your collagen. You're just asking your body to build collagen without giving it peptides. Like, what are you thinking? Like, and give it some silica too. Give it some silica to make it work better. I'm telling you, I know what I'm talking about, please. Okay, so who is this good for and what other areas does it work for? Because this is a really cool kind of thing. And I'm gonna let you guys know like how well this did. So far, I don't see any real changes right now. I have noticed that it's not as thin looking. I don't notice it as much in the mirror, but I will say that I don't see any huge results from it yet, and I'm not expecting to. I'm expecting to wait till, you know, that good 4-week mark to really start seeing changes. PRF is actually pretty incredibly versatile, and here's other areas that it works for. Remember, it works for the under eyes, thinning, fine lines, crepiness, dark hollow look. If your dark circles are from thin skin showing blood vessels, this is worth seriously considering, which is what mine was. So if they're from pigmentation, PRF helps, but it's not really gonna like resolve it for you. It's great for the nasolabial fold area, which is where I did it as well. And I'm looking to results there because I've been able to make a lot of changes to my skin that's helped kind of pull those up, but I'd like to see them tighter, right? And so that's why I decided to do them in the nasolabial folds as well. The cheek and mid face, you can get subtle changes to volume and texture, right? If you have any kind of hollowing. So another thing that she did, and she's so sweet. I loved her. She was such a great esthetician. I had a little bit of a dip in my cheek right here, and she went ahead and injected what she had left over after all of this. She injected it in there to give it more fullness and volume in my cheeks. And she did it over here too, because I have some volume loss at the top of my cheeks particularly, and this does help for that. So if that's something that's been bothering you, this is something that you could look for that is more natural. It's using your own body. You're not getting an actual filler. So this really will work for that area. And I'm thinking about going back to have my cheeks done at the top, and then my marionette lines down here, because I've seen a little bit of volume loss in those areas, especially as I age. And this is one thing that does help with that, because it goes down, and it's not just getting the skin, it's also getting all the underlying tissue as well. It's really just shooting all of that platelet-rich fibrin, which will help your body kind of boost up and fill that stuff in. So it's actually a great thing if you're seeing a little bit of volume loss. Now, serious volume loss, you're not going to see a huge change, right? Though that has to be addressed with other things. Also, for the marionette lines, neck, chest, anything like that, crepey texture, it works for acne scarring. It works well for acne scarring, especially when you combine it with microneedling. So microneedling with that PRF is amazing for acne scars. And then hair restoration, they have seen some promise with PRF and hair restoration. I will tell you that even though the PRF gel is amazing, I think the gel is the best, right? If you just try to like spin down your own blood and create your own PRP, guys, there hasn't been a lot of evidence that PRP microneedling, even though it's all the rage, even though vampire facials are all the rage, most of the results are actually coming from microneedling. So I found that interesting because I did a few deep dives into those studies because I was like, maybe I should spin down my own blood. Now, who is this not for? Guys, if you cannot treat certain things for this, like under eye bagging will not be treated with this. That is blepharoplasty only, or, you know, other things that you can do, but that's more of a surgical fix. PRF is not surgical. It's completely natural. It comes from your blood, and it can only really help with skin quality. You can't reposition fat pads because of it. You can get a little bit of skin thickening boosting going on, but you cannot replace fat pad loss. So it's not for that. For results, most studies cite doing it every 6 to 12 months. And that's pretty much what my clinician said to me. She was like, well, you know, you might want to do it again in 5.5 months. And it's been shown to help it even more if you do like 1 or 2 more sessions. So you can get a pretty good outcome from doing 3 sessions that'll last for about a year or 2. So I may do 2 more sessions. I'm still thinking about it. So it was kind of pricey. So let's talk about how much it costs and how I saved money doing this, because I think you guys know I told you that I do work a full-time job and I am a teacher, right? I don't make a whole lot of money. So I'm trying to do this and I'm also trying to do it more natural. I'm very careful about how I spend my money and the stuff that I invest in, but I try to do it in a way that I can show you guys what I'm doing, and then maybe you can see if that's something for you, and also trying to help you save money when you do it, because I know that I need to save money when I'm doing these things. This whole procedure total cost me $695. That was just the procedure. That doesn't include the tip. That doesn't include any discounts that I might have had. So that's the total price of the treatment itself, was $695. You need to find a med spa with a loyalty program. That's my first thing. So you can pay like $199 and you're part of their loyalty program and you get 40% off all procedures. It saves money in the end, especially if you're talking about the difference between $1,000 and $500, right? You're spending a couple $100 to save several $100s. So it is worth it. Second is sign up for Allē. Now, Allē is an reward system for fillers mainly. And when I first got my lip filler, because I do have a little bit of lip filler, they signed me up for Allē. But the great thing about Allē is it doesn't just work for fillers, right? Allē is a rewards loyalty program and you can earn points on any kind of stuff you do at the med spa. So not just injectables. And when you spend more, you save more. So they give you discounts. Now for this treatment, Allē gave me a reward of, I think, $75. So that brought my total down to $625 for the treatment. And then ask also about packages. So if you can sign up and save more in a package of microneedling treatments or these kinds of treatments, they will often sell them in packages of 3, and then you get a little bit of a discount with that too. But I haven't done a lot at the med spa, so it's not like I get a lot of stuff done there. 4, and this is the most important, don't sacrifice quality for price. There's things like Groupon and stuff, and sometimes you can get some lower quality stuff. Be very careful. Make sure you're going to a reputable med spa, a reputable place, and look at the Google reviews to make sure that the practitioner that you're with is not going to do something crazy to you. The med spa that I go to also does my hair. So I do know the people there and I know which people they suggest. Do your homework a little bit on that. The good thing is most places that you're gonna go, it'll be a nurse doing it. So they know what they're doing, they know anatomy, and you're gonna be fine. So as I told you, my whole total procedure was $695. They took $75 off the top because of my Allē, so I got it for $625. So it was expensive, something that I might not do again because it was so expensive. So I'm kind of waiting to see what are the results. Was it worth every penny? Quick transparency, because I have a recent comment asking what procedures I've had, and the list is super short, right? I've had Botox very conservatively, lip filler also pretty conservatively. I don't get a ton of lip filler. The last time she filled my lips was about a year ago, and she put only half a vial for my total lips. So like very little. Think of a whole vial as a ketchup packet. Okay, so it was not very much at all, because I'm not looking for an unnatural lip. I'm just looking for a little bit bigger to fit my facial structure. My lips were just really tiny compared to my whole face. And so I like how the filler gives me a little bit bigger, but it doesn't look too overdone. And the girl I go to, she makes sure to follow the lines of my natural lips. She like does it right. You know, she also checks to make sure that I don't have any run over or migration on my lips. My philosophy, oh, and now PRF, and I've had some facials done, some stuff like that, some microneedling, you guys know about that, but I don't do a lot of procedures. My philosophy is less is more, right? Natural looking is the goal. We do not want to look like we have filler in our face. We don't want to look like we've had a bunch of procedures. That's not a good look. Natural is the goal. Every procedure should serve a purpose. I never want to look like I've had work done. I want to look like the best version of myself for my age. I want to age more naturally. So I'm going to be tracking this over the next few weeks, and I'm going to have to let you guys know how well this procedure did. But I wanted to share what I did and some pictures from it because I'm super excited, and I'm hoping that this does take away those hollows, because y'all know I've been complaining about these for at least the last 2 years. So subscribe so you won't miss any of these updates, and drop your PRF questions in the comments. I read every single comment and respond to them. So thank you for being here. Follow me if you want more tips on how to age beautifully, and I'll see you next time on Glow Up with Shelly.